Senate Committee Health and Education, Labor, and Pensions will come to order. I'm delighted to steal the gavel this morning from the chair, and I apologize to my colleagues. I clearly was the only one that had people that were late for their appointments this morning, so it threw me back about 5 minutes. I apologize to our witnesses. I thank the chairman and the ranking member Murray, and excuse me. I want to thank my good friend Bob Casey for his willingness to work with me on this hearing, as well as a number of other initiatives that he and I have joined together on. And once we've made some opening statements, I'll have an opportunity to introduce formally our witnesses today. I'm pleased to have the opportunity to chair today's hearing on such an important topic that is a key aspect of our national security. Our work to strengthen our nation's medical and public health preparedness and response has always been bipartisan. So it's fitting that Senator Casey, who has been a strong partner on these issues over the year, is serving as the ranking member of today's hearing. The American people expect us to do all that we can do to protect them from the full range of threats that we face, whether they're naturally occurring, as we've seen with the emergence of novel influenza strains, or are deliberate man-made attacks. Regardless of the source of these threats, we must be well prepared to respond and to protect the American people. In the aftermath of Katrina, Congress, through the Pandemic and All Hazards Preparedness Act, established the position of the Assistant Secretary of Preparedness and Response. The ASPR position was created to clearly answer the question of who's in charge during a public health emergency. The statute is clear and there should be no confusion at this point. We need to examine why, in the midst of Ebola response, there was uncertainty at this point. This was exactly one of the issues that we were trying to avoid by speaking clearly to who was in charge in PAPA and strengthening the role of the ASPR in the 2013 reauthorization of the law. Today's hearing asks a very simple but critical question. Are we ready for future threats? Our recent experiences with Ebola suggest that there's still room for improvement to make sure that we're prepared and as prepared as possible. And our healthcare system was not fully stressed in those response efforts. As with each public health emergency before, we must apply what we've learned from our response to Ebola to strengthen our overall medical and public health preparedness and response efforts so that we're better prepared for the next threat we face. We cannot put off taking the steps that we must today to better be prepared tomorrow. We need consistent and strong leadership and support at all levels in carrying out our medical and public health preparedness and response efforts. There must be a daily focus and urgency to this work, not just when we're in the midst of responding to a crisis at hand. These efforts must be prioritized. That is how we ensure that we're better prepared to respond to the full range of threats we may face. Ebola underscores the importance of having medical countermeasures as part of our response arsenal. Today, the Biomedical Advanced Research and Development Authority not only manages the BioShield Special Reserve Fund, our Medical Countermeasure Procurement Fund, but BARDA is also actively helping innovators bridge the advanced research and development valley of death to bring forward innovation and innovative medical products and platform technologies that will play a critical role in protecting the American people. While these efforts have resulted in the development, approval, and stockpiling of medical countermeasures that we didn't have a decade ago, we know that we cannot let up on these efforts because there's much work left to be done. We still do not have any vaccines or therapeutics for some of the most serious identified threats. We must be prepared for what we have already identified, while also having the capabilities to quickly pivot and execute the development of vaccines and treatments for novel and emerging threats. The ASPR, BARDA, FDA, and CDC are all before the committee today because of the critical coordination that must occur between each of these agencies in bringing forward medical countermeasures to the strategic national stockpile, as well as the coordination between all facets of our medical and public health preparedness and response efforts, including critical partnerships with states and local public health officials and our nation's healthcare providers. Their efforts, together with the important work of the National Institute of Health, is critical for ensuring that we are as prepared as possible. There's been improvement in the coordination across these agencies, but we must ensure that these efforts are as timely and seamless as possible. I look forward to hearing from our witnesses today on what is working well, where there are still areas for improvement, and how Congress and the administration can work together to ensure that we are prepared as possible for the future threats we face. Almost 2 years ago, Congress passed with overwhelming bipartisan support the Pandemic and All Hazard Preparedness Reauthorization Act, legislation I authored with my colleagues on this committee and which the President signed into law. Today's hearing provides a good opportunity to look at the aspects of PAPA that have not gotten as much attention in recent months and years, but are very important. I want to take this opportunity to underscore that each provision of the law was very carefully and intentionally crafted the way that it was. While the administration has leveraged some provisions in the law, such as the FDA utilizing the authorized use authorities to more quickly respond to H7N9 and MERS and Ebola, including an authorization on another Ebola diagnostic just this week, other requirements remain outstanding. The deliverables required by PAPA are not optional. Unfortunately, it took moving forward with this hearing for a long-awaited 5-year medical countermeasure budget plan and the latest strategy and implementation plan to be sent to Congress. If it's going to take the scheduling of regular oversight hearings to ensure timely action and response in these areas, then that's something that I'm more than happy to chair on behalf of you, Chairman Alexander, because the urgency of this work cannot be overstated. Our actions and inactions in this area impact the health of the American people and our nation's overall security. Medical and public health preparedness and response is a matter of national security. I want to thank each of our witnesses for being here today, for taking the time to be here, for the efforts that you put into your work and for your expertise. I look forward to the hearing and to your thoughts on how we ensure that we're prepared for the future threats. I would recognize